Now, many of you who've been dealing with groin pain in the front have been told it's associated to hip impingement or FAI, associated to a cam deformity, a pincer, and so on. Now, I'm going to show you in this video one way that we're able to help people relieve pain very quickly with hip impingement. And just to be fair, it's not a long-term strategy, it's just pain management. It's something we use here at Performance Play Sports Care. So we're going to cover it today with these two different objects that you probably have access to at home. Hey everyone, I'm Sebastian at Performance Play Sports Care, part of locally world-famous chiropractors in Costa Mesa, California. Remember, we have virtual and in-person services if you want some help, and we have a webinar in the corner which is super helpful to figure out what diagnostic category you might actually have and some helpful tips that you may not find on YouTube anywhere. Now, with hip impingement, the easiest thing to do is do what we call a position of comfort. So I'm going to slide this guy out first and use this guy. Now, many times when I use this with people, they say, well, where can I get one of these fun pillows? You don't need one. You just need a pillow. But you need something firm. This is just happens to be what I have. Now, for some people dealing with this front of groin pain here, being in what we call an offloader position is super helpful. Now, I'm just going to set it up here to where the pillow is supporting my thigh, not my knee, my thigh. Okay, so you may have to bunch it up a little bit here, and I'm going to put it right about there. Okay, and so my other leg doesn't really matter too much. And I'm going to take this knee, which right now is vertical, I'm going to let it flop out, and notice my foot down there. My foot is coming in a little bit, so I'm almost in a figure four, but I'm super relaxed in it. In this position right here, if you just stay here, for some people this works out very, very well. Other people need a little bit more of what we call breathing strategy or desensitizing strategy. For this, we're going to take the fingers, and you may need to rewind this video a few times for this. This is not something that tends to go super well with like a video like this, but it is very coachable virtually. And so go like this, and you go like this, and you hungry hippo there. Okay, so I'm squeezing myself, and now I'm going to push my guts just a little bit into the back fingers. That does not mean push your back into the ground. It means just spread out like a blowfish. Okay, and I'm just going to keep that pressure as I talk or breathe and so on. Notice I'm not straining, because that's a whole different thing. Okay, that's a whole different stabilization strategy. So we're just going to breathe and keep some support into the fingers and wait a minute. And when you wait the minute, you may be surprised this generally feels better. Okay, so that's option one. The option two is we use something like a dinner table chair. I don't have one here, so I'm going to use this. Actually, the dinner table chair is a little bit better, but it allows my hips to slide underneath the actual chair. And this one, I'm just at 90. You do the same breathing part, but essentially here, the knees are a little bit wider than the feet, but the feet aren't generally touching. Okay, and you push your heels a little bit, just slightly, like 5%, 5 pounds of pressure into the table. And then you hang out here and you breathe. This is what we call the 90-90 rescue position. Some people call it the hook line position. And you just hang out here and breathe and relax. Now, this is the way to take the edge off. I've met a lot of people who have done these two strategies, and the first time they did them, they said, well, it didn't really help. Well, what did it do? Well, it made it go away a little bit, but I still hurt. Right, but if you think of using these as a dosage effect, almost like when you go to the doctor's office and they give you an antibiotic, they say, here's one, and go to the pharmacy down the street and pick up the remainder, and I want you to do remainder of these for the next 5 days and so on. Let's just see what happens. For some people, it takes a little bit of time. It takes a few days, and these tend to help out pretty dramatically. But in the moment, when people are testing things, sometimes they say, no, it doesn't really work. Right, it doesn't work in isolation, but the dosage effect generally does. And for those of you looking for help, just so you know, like these are things that we put on YouTube because I'm posing a certain scenario. When you see us in person or in virtual, we don't guess, we assess. So there's specific assessments like a physical examination that's stress testing certain areas of the hip, the low back, and the leg to figure out what is the best of these two options or other options that we may have for you. We don't guess, we assess, okay? If you do the wrong one, you may feel worse. That's what happens if you guess. Don't guess, assess. So subscribe to this channel and watch the remaining videos that we have available on YouTube. We have a series of hip impingement that's coming out, and we're going to cover various different questions and stretches and things like this, which can be helpful for information. Maybe you guys get help on YouTube, that's fine. But if you don't, please reach out to us. Complex cases sometimes need help. And as I tell everybody who comes in, they say, well, my friend had it, you know, and it went away. How come mine didn't go away? I said, if it was simple, it would have solved itself. You know, and that's the fact of the matter. If it was simple, it would go away on its own, but for some people it doesn't, and you need professional help. So we can help you if you'd like the help. We do virtual and in-person services. To reach out to us via the link in the description for the video. We'll see you next time.